We do want to begin, though, with Congresswoman Gabrielle Giffords. Just 2 days ago, of course, she watched her husband launch into space on the shuttle Endeavour. It successfully docked at the International Space Station earlier this morning. Today, back in Houston, Giffords is having surgery on her wounded skull. Medical correspondent Dr. Jennifer Ashton is here with the very latest on that. Jen, good morning.
Good morning, Erica. Today's surgery marks another milestone in what's already been a remarkable recovery. Doctors at this Houston hospital will use a plastic implant to replace a piece of Congresswoman Gabrielle Giffords' skull.
They've decided to use a fabricated segment as opposed to her original. They feel it's safer, cleaner, and actually it's a better piece, a puzzle piece sort of fitting in there, if you can imagine that.
In January, surgeons removed a section of bone to relieve brain swelling after Giffords was shot in the head. Since then, she's been wearing a protective helmet while undergoing rehabilitation.
Lift off for the final launch of Endeavour.
Today's surgery comes just days after Giffords traveled to the Kennedy Space Center to watch her husband, Commander Mark Kelly, blast off on the shuttle Endeavour. The crew's first day in space began with a song chosen by Giffords and Kelly's two daughters.
I want to thank Gabby, Claudia, and Claire for that great wake-up song.
Even before his mission, Kelly was confident his wife would continue making strides while he was gone.
When I get back in a few weeks, she's going to be noticeably different than when I left. I mean, I know that's the case.
Giffords' surgery is expected to last anywhere from 1.5 to 2 hours. If all goes well, she'll be back to rehab in a few days.
Jen, when you look at this surgery, 1.5 to 2 hours, as we heard, what are the risks associated with it?
Really, Erica, the main risk here is infection. And I spoke to a reconstructive plastic surgeon who explained to us that the actual piece of plastic that they're using to replace that missing part of her skull with has been custom molded using CAT scans, CT scans, to conform to the exact shape of her skull and brain. It's more accurate than the bone fragment that was removed, and it's in much better shape than that bone fragment that was removed in January.
So that all portends well.
Absolutely.
Why now, do you think, for the surgery? Is this the normal timeline of events, or is there something else at play?
It's roughly within the normal time window. It normally gets replaced about 3 months after it was removed. But more likely here, Erica, there was no pressing medical urgency to replace this. They didn't just decide to do this yesterday. Likely, it's more the case of a wife who didn't want to distract her husband from a task at hand and just wanted to quietly undergo this yet critical piece of her recovery.
All right, and we'll be watching and listening for that outcome. Jen,
absolutely.
Thanks.